Almost 1.2 million people are food insecure in Niger. It's estimated over 380,000 children suffer from severe acute malnutrition. 38,000 children under the age of 5 years old are estimated to die every year from causes linked to malnutrition. Chiabu is a small village in Zinder, the region with the highest rate of global acute malnutrition in the whole of Niger. Here, over 19% of children aged between 6 months and 5 years suffer either from severe acute malnutrition or moderate malnutrition. The WHO crisis threshold is 15%. In Chiabu, mothers are trained to screen their children by MWAC, the middle underarm circumference, as a way of early diagnosis of severe acute malnutrition.
It's very useful because I use MWAC every week to check how my child is doing. I started with my second child when she was diagnosed with moderate acute malnutrition.
The NGO Alima started this project 6 years ago in this district of Miria. The idea of shifting the diagnosis from a strictly hospital-based approach to a decentralized method has come a long way.
In Niger, we have trained around 1,650,000 mothers. 540,000 are in the district of Miria. The main advantage is the early diagnosis, which prevents hospitalizations.
Ruma is among the mothers who have been using the MWAC for years in the village. Her 1-year-old daughter Sharifa suffers from moderate acute malnutrition, and Ruma measures her often to avert her from falling into severe acute malnutrition.
We have a field, but the harvest is not enough to cover our food needs. We have to purchase food, but the money is not enough either. Among my 8 children, 3 have suffered from malnutrition.
Every 2 weeks, Ruma walks to the Gafati Health Center, 12 kilometers away. Here, children with malnutrition like her daughter receive specific food supplies and are monitored for 8 to 12 weeks. Mother screenings have increased the number of moderate acute malnutrition cases referred to local health centers like this one.
The number of severe acute malnutrition cases in the first 6 months of the year has decreased by 13% compared to the same period last year.
Mother screenings haven't had any impact at national level so far. We traveled to the region's capital, Zinder, and discovered that the number of severely malnourished children at the National Hospital hasn't significantly changed in the past years.
We can register between 8,000 and 9,000 cases of severely malnourished children per year. The worst month is September, with around 1,200 cases.
Over the years, the EU has funded over 50% of the medical treatment for severely malnourished children in the Sahel, a region where 486,000 children still die every year from causes related to malnutrition. In Niger, the EU has supported trainings for mothers as a means of prevention. This is also about making women active elements of the humanitarian response.
Indeed, this is the perfect example of how women's needs and capacities were taken into account in the response. I mean, you give them information that they previously didn't have, you empower them to take better care of their health of their children. I mean, you may have one health worker per village, but you will always have one mother per home, so they can be your best asset.
Experts say it will take years for mother screenings to reveal their impact nationally. Nevertheless, at a local level, mothers and children are already benefiting from the effects of this silent revolution.